Welcome to the Low Back Longevity Series. My name is Dr. Teresa Larson. I'm a Marine Corps veteran and a doctor of physical therapy. And in this video in particular, we are going to be talking about all the things that are going to help you manage low back discomfort. In this video, we will discuss who gets low back issues, the outcomes of low back issues, what can you expect, what behaviors increase your chances of having low back issues, and how do you help yourself with your current low back issues. So get excited. Here's the thing. Low back discomfort is a common complaint for most people. You may be even standing there watching this and have it too. Veterans, active duty military, most civilians have it. Here, we offer some information on low back discomfort to decrease the mystery and fear associated with this very common condition and empower viewers like you to take action through regular movement routines and self-care habits that support low back longevity and musculoskeletal health. Remember, self-care is healthcare. So who gets low back discomfort? The simple answer is almost everyone. I've had it. Low back issues are incredibly common, so much so that some estimates place the lifetime prevalence of low back stiffness, tightness, and aching at 84%, meaning that 84% of the population will report problems with their low back at some point in their life. Unfortunately, for most people, the low back is an anatomical mystery and brings with it a lot of uncertainty about what's safe and fear of having long-term dysfunction. This can result in years of hearing friends or family members lament the loss of their activities or function due to their bad back. And this fear of back problems can get in the way of doing things that they love and that are meaningful. So what's the prognosis? Fortunately, a large body of research tells us that we can expect a 50% improvement in tightness and discomfort in the first 6 weeks after a low back flare-up, and continued improvement from there. However, it's not abnormal to have low back problems last longer, and 60 to 80% of people who may continue to have issues with their back after even a year. This makes it critically important to arm yourself with an understanding of the low back and build habits and self-care practices that allow you to continue your activities as much as possible when dealing with a flare-up. Remember, self-care is your best form of healthcare. What increases your chances of having back discomfort? There are many risk factors for low back problems. Some that we have control over and some that we do not. In the factors we can control category are poor general health that includes smoking, obesity, sleep problems, general fatigue, sitting or driving more than 2 hours at a time, prolonged positions such as even standing, bending forward, think long day of yard work, hunched over, if you're not used to doing it that much, and even periods of walking, like long periods of walking, if you're not used to it. The bottom line is that our low backs need both movement and rest. And in general, it's better to over-prepare your bodies through regular movement than to be under-prepared for something like 4 hours of shoveling snow or gardening. There are also some psychological risk factors for low back problems that are important because it forces us to recognize the role that mental and spiritual health plays on how our backs feel. Some things that put us at higher risk for back stiffness include monotonous work, doing the same thing over and over all the time, being stressed all the time, especially distressed, nervous or tense, being dissatisfied with life, and having depression or anxiety. This means that we can likely improve how our bodies feel and the resulting stressors or stress by incorporating relaxation or stress management techniques and mind-body practices like mindfulness aka building awareness, yoga, and some of the other mindful movements that I'm going to be showing here pretty soon. So how do you manage tightness and keep your low back healthy? Moving the body is incredibly important for total body and mind and low back health. Regular exercise can decrease the risk for low back discomfort by 33%. And it is protective against disability. Most recommendations are for strengthening combined with aerobic exercise or stretching 2 or 3 times per week. As all of our body parts are connected, it's helpful to work on more than just the low back to get the best results. This may include hips, upper back, legs, and core. Think above or below the low back, mid back, hips, thighs, ankles, things like that. As we saw above, holding any posture for a prolonged period of time can be hard on our backs. Our bodies need to move, and physical therapists use the phrase motion is lotion a lot to simplify all the benefits that movement gives us, including blood flow to our muscles and lubrication to our joints. They need it. Often, our joints, tendons, and muscles will let us know when we need to move, usually through sensations of muscle tightness, dull aching, or muscle cramping, or even joint stiffness. But it's a good practice to get moving before our bodies start to complain. And the good rule of thumb is every 25 minutes. Set a timer. It can be also helpful to get moving first thing in the morning since our bodies have been relatively still all night, or even gently before bed to help us downregulate, aka calm down, and de-stress from the day. Movement doesn't have to be complicated, and it doesn't have to take more than a few minutes at a time to feel loosened up and energized. We all have a few minutes, believe me. Check out the other videos in this series for low back specific strength and mobility routines led by me. In addition to exercise though, working on your sleep, length and quality of it, nutrition, and mental health are other pillars to building a resilient and healthy low back. You got this.